Welcome to Your Family's Health, the program that focuses on healthcare issues with unique and different modalities for taking charge of your health today. Experts talk weekly with our continuing roster of guests from around the country and right here in Nassau County to keep you up to date on the latest health issues and trends. Take care of your mind, body, and soul. Spend the next half hour with the voice of Nassau Community College, 90.3 WHPC, and get on the journey to better health.
Hello and welcome to Your Family's Health. My name is Dr. Janine Cookerard from the nursing department here at Nassau Community College. Today we're going to focus on women's health. But men, listen, don't go anywhere. You might learn something that's going to help the ladies in your life. My guest today is Dr. Peggy Roberts, a board-certified, New York licensed women's health nurse practitioner. She has spent over a decade caring for women of all ages through her practice called Trust Women's Healthcare. She also serves on the board of the Nurse Practitioner Association of New York and as an active member of the Nurse Practitioner Women's Health Nurse Practitioner Association and is an assistant clinical professor at Hofstra University. And might I add, a graduate of Nassau Community College's nursing program here at Nassau Community College. She is and was a part of the class of 2008. My former student, I'm so excited. Dr. Roberts, welcome to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC, and welcome to you.
Thank you so much for having me. I'm very excited for today and seeing you, Dr. Cook-Gerard.
Oh, my goodness. So the first time I saw you, it was at a nurse practitioner conference, and I don't know if you came up to me or I came up to you, but immediately I said, oh my God, I can't believe, right?
Yes.
And then you started telling me about your practice, and I'm so in awe. So tell me more about yourself and what made you to decide to focus on women's health after you graduated.
So during my doctoral studies, I started focusing on maternal morbidity and mortality and how Black women are 3 times more likely to die from pregnancy complications. I always loved women's health. I went into women's health because I believe that women, we are the center of the families and we neglect ourselves. So during my doctoral studies, I wanted to do more. I wanted to be part of the solution. So with that being said, I decided to open Trust Women's Healthcare in Brooklyn, New York, where we provide comprehensive and holistic care to women. Our mission is that every woman's concerns will be heard and addressed. And thereby, that's why I do what I do. That's why I see thousands of women and to make impact into women's health where it's so needed.
That is awesome. So let's just start out by asking you, what is the biggest thing you want women to know when they come into your practice? Tell me your approach. When a woman comes into your practice, what is the first thing you do?
Well, my practice creates a inviting environment. I think that that's very important. When you enter my practice, you have the lavender walls. The office smells like lavender.
Wow.
It's very calming.
Okay.
I have a chandelier in the office.
Oh, I love chandeliers.
It's bright. It's airy. So that, I think, sets the tone for the visit. The next thing is that our appointments are spaced out. So women who come in are seen almost immediately. They're taken in by one of my client experience specialists. They're put into the room. And then I come in. And when I come in, I always introduce myself, especially if it's a new client. And that's the other thing. We address our patients as clients because this is shared decision making. And we want clients to know that they're a part of their care. It's not being told what to do, but it's more of a recommendation and shared decision making. I come in, I introduce myself, I sit down. Okay. And we have a conversation and
You learned that in nursing school.
Yes, absolutely. That is definitely a foundation. Yeah. Women are given gowns, not the paper cloth that you're used to. Nice. And I sit and we talk and we have a conversation. And I ask them always, why are you here and what concerns would you like me to address?
So this is your practice. You're a nurse practitioner. And a lot of people get confused with the role of a nurse practitioner as opposed to a physician. Mm-hmm. You have your own private practice. You do not need a collaborating physician.
No, I do not. In the state of New York, nurse practitioners, we do not need a collaborating physician. It's a full practicing authority state. And again, it varies from state to state. But it allows me to open my own practice, to see patients, to prescribe, to diagnose, to treat. And so it gives me, the state of New York has given me a license in order to do that, along with the educational component that I've completed. I believe that we are all part of the healthcare team when it comes to women's health. I do have physician partners that, constantly that we have conversations on. So I think that it's important to know that it's not one or the other.
How many people are in your practice? How many people do you have working in your practice?
So I'm the only provider there. That's one of the things that women appreciate, the continuity of care. I know my patients very well. And then I have a team of about staff of 9,
wow.
Which is a lot for one provider.
That's a lot.
But another thing with mission and vision of the practice is that every patient, every client knows their results, whether they're good or bad. So I do have another provider, a nurse practitioner, who actually goes over every result with the patient. And in order to know their numbers, which it goes back to initially what is that we want women to know is that they need to know their numbers.
Yeah.
And I think it's important. And what do they mean?
Yes.
What is your baseline?
Yes.
So I think that it's important. And that's what we usually do with our clients. So I have the nurse practitioner. I do have client experience specialists, which also are medical assistants, administrative work as well. I have sonographers because we do ultrasounds. I think that there are many women who come into the practice not having had an ultrasound.
Yes.
And I'm able to diagnose things that they didn't even know, whether it's fibroids or having a bicornuate uterus, which is a uterine anomaly, or having so a plethora of things.
Yes.
So I think that that's important as well.
So when you say numbers, what are you referring to? Is that the laboratory results? What numbers are you referring to?
So I think it's a combination. It starts with knowing your vital signs, your baseline blood pressure. That's very important. We all know white coat hypertension is real, which is when you go into a provider's office, your blood pressure is raised because you're nervous. You don't know what's going to happen, especially if it's a new provider. So knowing what your baseline blood pressure is. Also knowing what your diabetes risk is, which is your hemoglobin A1C, so that when you're called with the result, you know whether there is a change.
Right.
Your cholesterol, your liver function, kidney function. What about your STD status? That is very important. Your weight. I have women who come in and have an idea of what their weight is, and they step on the scale and it's completely different.
Yes.
So I think that, not saying that you need to weigh yourselves every day,
right.
but you should have an idea of what it is.
Some baseline.
Baseline. And also, just in terms of labs like your hemoglobin, which looks at your anemia status, to know, many times women come in and they'll say, I'm cold all the time, or I'm tired, or I'm eating eating on ice.
Yes.
So just knowing if you are anemic or not. So those are, I think, the baseline. And we go over all of those numbers in details and what that mean.
Does that mean that you give your clients a call at home, or is this a discussion that you have in your office, or both?
Both. If they come in for a follow-up, at that time, I would discuss their labs, or it's a phone call. If we're unable to reach the client, then we also have a portal where we're able to communicate. Everyone is set up in the portal.
That's great.
So the results are not made available until we've spoken to you, because again, that alleviates the anxiety of seeing numbers that you just don't know.
So how often should a woman have a well visit? Is it annually? Is it biannually? Talk to me about that.
At my practice, I believe that a woman should have an annual every year. I believe that there are things that change from year to year. Family history may change. You may have gone to a family outing and found out that, a family member had a certain condition that may affect you at some point. Right. our health changes. COVID definitely proved that. So I think that annual visit is definitely recommended. And then at that annual, we'll discuss what we're going to do during that annual, whether it's you're due for a pap smear, which is a preventative screening,
Yes.
if you're due for certain lab results, if we want to follow up on any ultrasound findings that we found in the previous year. I think that far too long that women have gone years without being seen. And I feel that we're playing catch up with health. And so I think it's important to know that to go every year, especially if you have insurance benefits, it's part of your benefit package.
Yeah.
So I think that it behooves every woman to be seen every year.
So you talked about screening. What screening should I be concerned with as a woman? You talked about mammographies. Is there any other screening that I need to be concerned with or that I should be regularly checking on as a woman?
Absolutely. So I believe that depending upon the age, so let's start with prior to 40. I think that clinical breast exams, I still do a clinical breast exams. And, sometimes data comes out, with different evidence. But again, I still use that as a guideline. But I think clinical breast exams are important, especially that there's still women being diagnosed with breast cancer in their 20s and 30s.
Yeah.
I think having, whether it be a pap smear with co-testing HPV or just having a vaginal culture is definitely important. And then also blood pressure screening, as I mentioned before, some baseline STD testing. I think that that's very important. And then to find out what else is going on that might be specific to that client. When we start to go over 40, obviously mammography that you just mentioned is important. And colonoscopies. Now the recommendations are a little bit earlier. So I think that it's important to know that and to know what your risks are. And then also we can't forget about the mental health screenings.
Oh, yes.
Which is
I was going to ask you about
very
that.
important.
Yes.
And I think that seeing a provider annually that you feel comfortable with, that will also be part of it. Yeah. And if there are services that are needed, that's where the referral occurs.
You're listening to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. My name is Dr. Janine Cookerard, and today you're learning about women's health. My guest today is Dr. Peggy Roberts, a board-certified and New York licensed women's health nurse practitioner. She's spent over a decade caring for women of all ages through her practice called Trust Women's Health Care. And I always like to add that she is a graduate of Nassau Community College's nursing program, the class of 2008. My next question for you, Dr. Peggy, is this. You talked about the psychological necessity for you to kind of screen women. Are we thinking about anxiety? Are we thinking about depression? What is the screening?
That can consist of something as simple of how are you feeling today? Because sometimes, again, I am not a behavioral health specialist, so I kind of refrain from the diagnosis of anxiety, depression, bipolar. But again, it's all about how are you feeling? Are you feeling that you are hopeless? That
Yes.
that there are a lot of things going on beyond your control?
Yes.
Do you feel that you just want to sleep and stay in bed all day? Do you feel very anxious when you go out or anxious in certain situations? So in having the conversation with my clients, I like to know how they're feeling, what is bothering them. And then at that point, if there is a need to refer them to a behavioral health specialist, we do have a list of referrals that we provide them, and to let them know that it's okay to not be okay. I think that it's important to know because there's this stigma behind mental health illness, and I want to destigmatize that. With the women that I see, and to know that if you're not okay, let's get you to a place where you're okay. And these are the resources that I can give you.
And what I do like about nursing, and let me just add this in there, is that nurses are really educated to communicate and to make their patients comfortable. So I'm sure you make your patients comfortable enough that they really are ready to open up and to really talk and really let out their concerns. So getting back to breast cancer, what are some of the key risks factors for breast cancer, and how can people know or kind of think that, I may be, this may be me or it may not be me? What are some of the risk factors?
Age is always one of them. Obviously, the older you are, the more you're at risk for developing breast cancer. family history is extremely, extremely important. And I believe that now we're in a society where we're asking more questions with our families in terms of, mom, what is your health like? Grandma, what did you go through? Aunties, what's going on? So I think that that's important, because if there is a family history, mom, grandma, that increases your risk as well. Also, obesity is always a risk factor for so many things.
Yeah.
And I think it's important to throw that in there as well.
Yeah.
There are other risk factors in terms of ages of or having your first child, or menopause. So, but initially, I believe that age being one of them, and family history is extremely important. And then also knowing your breasts.
Yes.
I encourage women. That's always a conversation. Do you do breast exams at home? You have to. You're at home more than you're at your provider's office.
Yes.
So it's important that you get to know yourself.
Yeah.
And if there's a concern, then you can bring it to your provider.
And definitely don't wait to bring it to your provider. Yeah. So some of the lifestyle changes, things that we can do that are modifiable, what may they be to lower the risk of breast cancer?
Definitely living a healthy diet lifestyle. What does that mean, right? We all say healthy diet. I think that having a well-balanced nutrition, and if you need to see a nutritionist in order to understand what that is, I think that that is important as well. Exercise, get moving. Again, I mentioned COVID before. COVID did not help.
It didn't.
Our modifiable lifestyle factors. So I think that it's important to get moving. I always encourage clients. I'm not encouraging you to go and join a gym, to spend that money, but you can walk at home.
Basic.
I'm okay. Very, very basic, but get that heart rate elevated. Definitely smoking, excessive alcohol use, drug use does increase that risk as well. These are all modifiable risk factors. And last but not least, that we should also address is stressful life factors, whether it be at home, at work. I think trying to reduce it as much as you can within the constraints of your life. I think that that's important as well.
It is. It's so important. So how about just switching the topic a little bit to birth control options? What do you recommend, particularly, I know as women age up until menopause, the options may be different, but what do you recommend for people for birth control?
So that's why at the practice, I definitely tailor the care to women. And when it comes to birth control, there's a lot of varying factors.
Yeah.
Let me say this. There are a lot of birth control options out there, a lot of options that are available now that weren't available 10, 20 years ago. There are some birth control is not for everyone. And I think that that's where your healthcare provider comes in. You have the traditional pill. You also have the long acting ones, whether it be the IUD or the Nexplanon implant in the arm. Or what is the purpose of birth control, right? It's not only for pregnancy prevention. It can be because you're having painful periods or abnormal periods. So I think it's important to know what the purpose of it is. There are also non-hormonal birth control that is out there as well. So for clients who don't want the hormones, there are options. And then there's also the Phexxi, which a lot of women don't know about. And it's really to be applied an hour before intercourse. So it's time intercourse. So there are a lot of options. There's always new methods coming on the market. So it definitely is important to have that conversation, but initially to know what the purpose is.
Yes.
I think that's very
What
important.
about the morning after pill?
The morning after, yes. It is there. It is an option. However, I want women to know that to not use it as birth control. And I think many times women kind of scale back and say, oh, well, I can just get the morning after pill. And what is not realized is that the morning after pill can also cause their menstrual cycles to become irregular. And then it's like, oh, my menstrual cycle is all out of whack. I don't know why. And it's because it's the morning after pill. So it is there. It is an option. I'm not going to say that. But if you find that you are using it more often, then come into your healthcare provider and let's discuss another more effective way in order to prevent pregnancy.
Yeah. So that may not be the optimal choice of option for birth control. What would you say is the most common gynecological issue that you treat in your office? I know.
Abnormal vaginal discharge. That it's one of those that, again, if women don't know what normal is,
Right.
they won't know what abnormal is. And I think that that's one of the most common. And it can be, again, vaginitis, which is a global term where it's just abnormal, whether it be excessive discharge or whether it be an odor or whether it be a change in color. So
what causes that?
It can be caused, depending upon what the diagnosis is, it can be caused by hygiene. It can be caused by sexual intercourse or sexual practices. Mm-hmm. It can be caused as something as wearing a wet bathing suit for too long. Mm-hmm. So I think at that time we have that conversation and educate my clients in terms of what normal is, what abnormal is, and also what are the things that we can do to kind of reduce that. And then I do get my frequent flyers with recurrent vaginitis. And so we need to delve a little bit further in what the culprit is and that underlying cause. And so that we can really treat the underlying cause and then so that they can get some relief.
That's great. You're listening to Your Family's Health on the Voice of Nassau Community College, 90.3 WHPC. My name is Dr. Janine Cook-Garrard, and today you're learning about women's health. My guest today is Dr. Peggy Roberts, a board-certified New York licensed women's health nurse practitioner. She has spent over a decade caring for women of all ages through her practice called Trust Women's Health Care. And also, too, here it goes, a graduate of Nassau Community College's nursing program, class of 2008. I happen to have been her professor. So, Dr. Peggy, let's go on to the next question.
Sure.
So, when you talk about, or maybe you can address pelvic health, what does that mean to have or to even assess for a patient's or client's, if you will, pelvic health?
So most often clients come complaining of some type of pelvic pain, whether it's pelvic pain during urination, to pelvic pain during sexual intercourse, and then we start to explore that. Sometimes after clients have had vaginal deliveries or childbirth, their pelvic floor becomes weakened, and that may lead to a pelvic floor disorder. So, again, doing the thorough workup, the evaluation, and sometimes I refer them to a physical therapy where they can get pelvic floor therapy, which a lot of women...
What does that include? Is that the Kegels? Typical?
So it's actually a little bit more than Kegels.
Okay.
It's actually with the physical therapist, and they go through different exercises on how to strengthen that pelvic floor.
Okay.
And I think that it's important because many women don't know that. And, Kegels is definitely something that I encourage all women to do. But then as women age and after childbearing ages, menopause, sometimes that pelvic floor is just really, really weak and can't hold a lot of things, including urine.
Right.
So I think that it's important to speak to your healthcare provider regarding those issues, especially if you're exhibiting those symptoms that I discussed, so that we can explore on how we can treat it. There's no need to bear with certain symptoms and just kind of chalk it up to, well, it's just related to age. There are things that, can be done and you can do in order to be relieved of these symptoms.
So what is Kegels? I just mentioned that, threw that word out there. What is it anyway?
So Kegels is strengthening your pelvic muscles. The easiest way I have women do Kegels is that when you are urinating is to stop in between and using those muscles. Those are the same muscles that you can use throughout the day. And it strengthens that pelvic floor as well.
Okay. So let's talk a little bit about menopause. Okay. So as you age, we expect to hit menopause. What is that? What age do we hit menopause? And tell me what goes with that.
So let me just say that menopause is a natural event in a woman's life. It is very natural. It happens. We cannot avoid it. I get that question as well. Can I avoid menopause? No, we cannot avoid menopause. So menopause, the average age right now, depending upon which data that you look at, is between the ages of 52 and 55. Women are living longer, so I guess that's why it's kind of expanding. And it's when you've had no menstrual cycles or period for 1 year. Exactly 1 year, not 11 months and 3 days.
And be clear,
yes,
that you can get pregnant.
Exactly. So yes, and what it is that you lose estrogen, which is a dominant hormone in reproductive age, like women when you're younger. Along with losing your period, as you say, it comes with debilitating symptoms sometimes, with hot flashes. You ever see that woman is just sitting there and all of a sudden she starts fanning herself? That can
Am
be...
I fanning myself?
No, not at all. So that is hot flashes, irritability, insomnia, trouble staying asleep. Also decreased libido, meaning no sexual desire or vaginal dryness. All of those things come with menopause. And now I see more of the conversation because we're making it more of a conversation. Decades ago, people didn't want to talk about menopause.
Right.
I don't know why. But now you're starting to see even celebrities discuss menopause as what they're going through. And I want women to know that there are options. I think it's very, very important to know that. Don't need to sit there and feel engulfed with heat. There is no, again, not being having desire for your partner. There is things that we can do. There are different options, whether it's hormonal options or non-hormonal options. And I think it's important to know that. And again, it goes back to what I continue to say, speaking to your healthcare provider. And if your healthcare provider is not fully versed on menopause treatments, then you need to find a provider that is.
Yes. So let's go about talking about this swanky office that you have. How can I find it? How can I find you? What is your website? Tell me about that.
Okay, sure. So I am located at 318 Gates Avenue in the Bedford-Stuyvesant section of Brooklyn. Okay. And you can follow us on all social media outlets at Trust Women's Healthcare. And our website is www.trustwomenshealthcare.com, and with the phone number of 929-78-TRUST.
So on your website, what can I find? Do I see resources? Do I see just a little bit about you? What am I going to find on that?
All of the above. You find about me, about the practice, some pictures about the practice. And then I have blogs that I do weekly regarding different topics. And then I talk about two important things. I talk about the health of BIPOC women, which are Black, Indigenous, and women of color. I think it's important to know that there are racial health disparities that exist within this population. I discuss maternal morbidity among women of color, specifically Black women, that Black women are 3 times more likely to die from pregnancy complications. So I definitely discuss that as well. And with the blogs, I'm very intentional on what I add to the website. And it's all based on questions that I get asked from clients in the practice. And then also, obviously, you can book an appointment, and we have our most up-to-date on our website.
So I'm going to come to take a look at this place.
Yes, absolutely.
So we want to thank you for being here. Dr. Peggy Roberts, a board-certified New York licensed women's health nurse practitioner. I am going to have you back.
Oh, thank you. I thank you so much for having me. I can talk about women's health all day. I'm passionate about women's health. I thank you for highlighting women's health, as it's so ignored by most outlets. So I appreciate it. And I thank you again for having me on.
You're welcome. This is Dr. Janine Cookerard from the Nursing Department here at Nassau Community College. And we want to thank you for listening to this week's edition of Your Family's Health.
We'd like to get your feedback on your family's health. Send your comments by emailing them to whpc@ncc.edu. Podcasts of today's show are available on iTunes, Android Podcasts, and Spreaker. This program was produced at the studios of Nassau Community College in cooperation with the Nursing Department. Join us next week for another edition of Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.